Atrial fibrillation affects about 3 million Americans in the United States. It's probably the most common sustained heart rhythm problem in the United States. The upper chambers, instead of working in coordination with the lower chambers, instead of beating 60 beats a minute or so as normal, beat about 600 to 800 times a minute. So instead of contracting normally, they basically sit there and they quiver, hence the term fibrillation. This does several things. The first thing is that the lower chambers can beat in response to this very fast. So they do not beat 600 to 800 times a minute, but they do beat very rapidly. And this rapid beating of the lower chambers can cause a cardiomyopathy, and this is called a tachycardia-induced cardiomyopathy, and that can lead to heart failure. The next thing is that it puts you at risk for stroke. So the upper chambers are no longer contracting effectively. Blood can become stagnant in the upper chambers and can break off and form and can embolize to a distant area and cause a stroke or other embolic phenomenon, like it can go to the arm or the leg. This is very dangerous. So we do several things. The first thing is that we control the rate of the lower chambers, and the next thing is that we control the chance or decrease the chance of stroke with blood thinners. These are Coumadin and the newer agents such as Pradaxa, Xarelto, Eliquis, and Savasa. They're all fairly effective at preventing stroke. If you're not on anticoagulation and you're a reasonably young age, your risk of stroke may be 5% per year. This sounds sort of low, but that's actually very high for us in general. So taking a blood thinner, the 5 agents that I talked about, decreases that risk of stroke to about 1% per year, with maybe another 1% per year chance of bleeding. The risk of all blood thinners is bleeding. Eventually, generally people will undergo a cardioversion if they have sustained atrial fibrillation. It doesn't come and go. They have to be on anticoagulation for at least 3 weeks prior to that. There may be ways to accelerate that with a transesophageal echo and other things. For a cardioversion, the anesthesiologist will make you sleepy. You're going to be in a very deep sleep, although it's very brief. You have patches placed the front and the back. And once you're asleep, we shock the heart back to normal rhythm. The chance of success of a cardioversion is pretty close to 100%. So almost everybody will convert back to normal sinus rhythm with a cardioversion. The issue is how long it will last. So I do tell all my patients that the chance that the atrial fibrillation is going to come back after cardioversion is 100%. Again, I'm okay if you prove me wrong, but it is almost always comes back. And the question, does it come back in a minute or a day or a week, a month, a year? It always comes back. We do want people on blood thinner at least 4 weeks after cardioversion. I would recommend at least 3 months. The issue is that most people cannot tell when the atrial fibrillation starts again. So if you're off blood thinner after you've had your month of anticoagulation after cardioversion, and you can't tell when it comes back again, you're at risk of stroke again. The reason that we have people on anticoagulation for at least a month after a cardioversion is because the atria can be stunned. So you see electrically that they have normal sinus rhythm restored, but it takes 3 to 4 weeks maybe for them to recover mechanical function where they actually start contracting again. So again, you're at risk of stroke immediately after cardioversion. Very important to maintain anticoagulation and not stop it for any reason, unless it's a dire emergency, and you probably talk to an electrophysiologist about it. There are different procedures for that may be helpful for atrial fibrillation. There is ablation. I do feel like it has a very high recurrence rate. It's my opinion. Pacemakers, I used to feel that they were helpful, but I'm feeling that they're not as helpful these days. The more pacemakers I've put in over the past 19 or 20 years, including people who have A-Fib, and we see how well it helps that. There is A-Fib surgery. There's different types that can be done, and this might be the most effective treatment for atrial fibrillation.